Welcome to the Dr. Izzy's Medical Podcast channel.
Question: what is the cell type of origin for a neoplasm that tests positive for S100, melanin or HMB45? Answer: melanocyte. Question: which cells myelinate the central nervous system? Answer: oligodendrocytes. Question: which wheat protein is targeted by antibodies in celiac disease? Answer: gliadin. Question: what is the risk of leiomyoma progressing into leiomyosarcoma? Answer: none. Leiomyosarcoma manifests de novo and not from leiomyoma. Question: which BRCA gene is associated with breast carcinoma in males? Answer: BRCA2. Question: which inflammatory muscle disorder often presents with a shawl and face rash? Answer: dermatomyositis. Question: which coronary artery is commonly occluded in an anteroseptal infarct? Answer: LAD. Question: which autoantibodies are associated with CREST syndrome? Answer: anti-centromere antibodies. Question: what cancer is associated with vinyl chloride? Answer: angiosarcoma of the liver. Question: what is the function of the Fimbria and Protactin virulence factors from Bordetella pertussis? Answer: adhesion. Question: what is the most common cause of dementia? Answer: Alzheimer's. Question: what group of renal disorders includes membranous nephropathy? Answer: nephrotic syndrome. Question: which lip is classically affected by basal cell carcinoma? Answer: upper lip. Question: how does PT change in hemophilia A or B? Answer: no change. Factors 8 and 9 are in the intrinsic pathway, PTT. Question: which type of T cells are involved with dermatomyositis? Answer: CD4 plus T cells. Question: how does functional vital capacity change in COPD? Answer: decrease. Question: which mechanism of cell death is always followed by acute inflammation? Answer: necrosis. Question: what are the four major chemoattractants for neutrophils? Answer: C5a, IL-8, LTB4, kinin. Question: which neoplasm is associated with tuberous sclerosis? Answer: giant cell astrocytoma, renal angiomyolipoma, cardiac rhabdomyoma. Question: what is the cause of appendicitis in children? Answer: lymphoid hyperplasia. Question: which method of spread do most carcinomas employ for metastasis? Answer: lymphatic. Question: what is the mechanism of action of the filamentous hemagglutinin toxin from Bordetella pertussis? Answer: attachment of Bordetella pertussis to respiratory epithelium. Question: which artery is commonly affected following rupture of a duodenal artery? Answer: gastroduodenal artery. Question: what kind of pain is associated with cystitis? Answer: suprapubic pain. Question: what is the prognosis of inflammatory invasive breast ductal carcinoma? Answer: poor. Question: what MCV is indicative of macrocytic anemia? Answer: greater than 100 femtoliter. Question: what DEXA score is diagnostic of osteoporosis? Answer: T-score of less than or equal to -2.5. Question: which enzyme in phagocytes converts hydrogen peroxide into hypochlorous acid? Answer: myeloperoxidase. Question: what is the mechanism of action of octreotide in the treatment of acromegaly? Answer: agonism at somatostatin receptors, thereby inhibiting growth hormone release. Question: what is the treatment for cluster headaches? Answer: inhaled oxygen and sumatriptan. Question: what is the mechanism of action of the tracheal cytotoxin from Bordetella pertussis? Answer: destruction of ciliated respiratory epithelium. Question: what is the most common cystic lesion of the pancreas? Answer: pancreatic pseudocyst. Question: what is the most common cause of sideroblastic anemia? Answer: alcohol. Question: which receptor does oxidized LDL bind to when it is taken up into macrophages in the pathogenesis of atherosclerosis? Answer: SRA, scavenger receptor. A question: how does the risk for B-cell, marginal zone, lymphoma change in Sjögren's syndrome? Answer: increased. Question: which type of radiation is associated with melanoma of the skin? Answer: non-ionizing. Question: what is the cell type of origin for a neoplasm with visible Burbeck granules? Answer: histiocyte. Question: what cancer is associated with HHV8? Answer: Kaposi sarcoma in AIDS patients. Question: what gross changes will you see at cardiac tissue 4 to 7 days following AMI? Answer: yellow pallor with hyperemic borders indicative of necrosis. Question: what is the mechanism of action of the pertussis toxin? Answer: ADP ribosylation of regulatory G proteins, thereby resulting in increased and overactive adenylate cyclase. Question: what is the genetic inheritance of Fragile X syndrome? Answer: X-linked. Question: what is the risk of carcinoma associated with fibroadenoma of the breast? Answer: none. Question: which chromosome is the egg-heavy chain found on? Answer: chromosome 14. Question: which bone disorder is associated with decreased bone mass? Answer: osteoporosis. Question: which enzyme secreted by CD8 plus T cells functions to enter the pores made by perforin and activate caspases? Answer: granzyme. Question: what does the Aaron-Kress syndrome stand for? Answer: Raynaud phenomenon. Question: what is the mechanism of action of tolvaptan in the treatment of the syndrome of inappropriate secretion of antidiuretic hormone, SIAD? Answer: selective antagonism at V2 receptors. Question: what cancer is associated with naphthylamine? Answer: urothelial carcinoma of the bladder. Question: which vaccine is used to vaccinate against Bordetella pertussis? Answer: DTaP vaccine. Question: which WHO class of lupus nephritis involves membranous glomerulopathy? Answer: 5. At this point it is full-blown nephrotic syndrome. Question: what is the risk of invasive carcinoma associated with apocrine metaplasia of the breast? Answer: none. Question: what is the cause of secondary polycythemia vera? Answer: a natural or artificial increase in EPO levels. Question: which organ is most commonly involved in systemic amyloidosis? Answer: kidney. Question: what is the single most important prognostic staging factor of cancer? Answer: metastasis. Question: what is the treatment for secondary hyperaldosteronism? Answer: spironolactone. Question: what is the cell type of origin for a neoplasm that tests positive for muscle-specific antigen? Answer: muscle. Question: what cancers are associated with HBV and HCV? Answer: hepatocellular carcinoma. Question: what is the incubation period of psittacosis? Answer: 5 to 15 days. Question: what is the cause of Lambert-Eaton syndrome? Answer: autoantibodies against presynaptic calcium channels of the neuromuscular junction. Question: which enzyme converts GLC to sorbitol in cells? Answer: aldose reductase. Question: which age group of women are commonly affected by embryonal rhabdomyosarcoma, sarcoma botryoides? Answer: less than 6 years old. Question: which type of leukemia is associated with smudge cells on a peripheral blood smear? Answer: SLL, CLL. Question: what is the etiology of osteoarthritis? Answer: joint wear and tear leads to destruction of articular cartilage. Question: how does arterial oxygen saturation change in anemia? Answer: normal. Question: which type of calcium nephrolithiasis precipitates with increased pH? Answer: calcium phosphate. Question: what is the most common cystic disease in children? Answer: renal dysplasia. Question: what is the most common tumor seen in premenopausal women? Answer: fibroadenoma of the breast. Question: what two mechanisms can lead to cell death? Answer: necrosis, apoptosis. Question: which transition point in the cell cycle is regulated by retinoblastoma protein? Answer: G1-S. Question: which cytokine typically promotes cancer cachexia? Answer: TNF-alpha. Question: what cluster personality disorder is obsessive-compulsive personality disorder? Answer: C. Question: what renal disorder is associated with waxy casts with granular cellular debris and sharp borders? Answer: chronic renal failure, indicating stasis within the renal tubules. Question: what is the genetic inheritance of juvenile polyposis syndrome? Answer: autosomal dominant. Question: in which trimester will placenta previa present as bleeding? Answer: third. Question: which area of the heart is most susceptible to ischemia? Answer: subendocardium. Question: which hormone produced by squamous cell carcinoma of the lung causes hypercalcemia? Answer: PTHrP. Question: what cancer can liver cirrhosis develop into? Answer: hepatocellular carcinoma. Question: what is the average age of onset of sporadic endometrial carcinoma? Answer: 70. Question: what demographic of women are more commonly affected by papillary carcinoma? Answer: postmenopausal. Question: what is the cause of bullous pemphigoid? Answer: IgG autoantibodies against hemidesmosome component BP180 of the basement membrane. Question: How does serum calcium change in primary hyperparathyroidism? Answer: Increase. Question: How does ejection fraction change in diastolic dysfunction? Answer: No change, it is normal ejection fraction. Question: Which pattern of necrosis is seen following an ischemic infarct at any organ except the brain? Answer: Coagulative necrosis. Question: Which two viruses are associated Reye syndrome due to aspirin administration? Answer: Varicella zoster virus and influenza B. Question: What is the mechanism of action of the adenylate cyclase toxin from Bordetella pertussis? Answer: Cytoplasmic adenyl cyclase increases. Question: What is the treatment for angioedema? Answer: Epinephrine. Question: What is the most common cause of chronic pyelonephritis in children? Answer: Vesicoureteral reflux. Question: What form of beta thalassemia is seen in someone who is heterozygous for mutations in the beta globin gene splice sites and promoter sequences? Answer: Beta thalassemia minor. Question: What gross morphological changes are seen at the heart 0 to 4 hours post-MI? Answer: None. Question: Which enzyme involved in scar formation removed type 3 collagen? Answer: collagenase. Requires zinc as a cofactor. Question: What gene is involved in inherited melanoma? Answer: P16 and K4A. Question: What pathology is associated with spherocytes? Answer: Hereditary spherocytosis or autoimmune hemolysis. Question: Which bacteria is able to form pustules, pimples, by infecting comedones and releasing pro-inflammatory fatty acids through bacterial lipase action on surrounding sebum? Answer: Propionobacterium acnes. Question: Which tumor is associated with the tumor suppressor gene P53? Answer: Most human cancers, Li-Fraumeni syndrome. Question: Which tumor marker is useful for monitoring the recurrence of colorectal cancer? Answer: CEA. Question: What cancer is associated with aflatoxin B1 from Aspergillus flavus? Answer: Hepatocellular carcinoma. Question: What pathologies are associated with teardrop cells? Answer: Bone marrow infiltration. For example, myelofibrosis. Question: What is the treatment for dilated cardiomyopathy? Answer: Heart transplant. Question: What is the grade of dysplasia for cells with hyperchromatic nuclei and a high nuclear to cytoplasmic ratio? Answer: High-grade dysplasia. Question: What are the sentinel lymph nodes for breast cancer? Answer: Axillary. Question: Where on the body is atopic dermatitis, eczema, commonly found? Answer: Face and flexor surfaces. Question: Which arterial partial pressure of oxygen is diagnostic of hypoxemia? Answer: Partial pressure of oxygen less than 60 mm of mercury. Question: Which inflammatory cytokines induce E-selectin expression in endothelium? Answer: TNF, IL-1. Question: Which tumor is associated with the tumor suppressor gene NF1? Answer: Neurofibromatosis type 1. NF1 does for a Ras-GT-Pase activating protein, neurofibromin. Question: Which stage of acute tubular necrosis is associated with the risk of hypokalemia? Answer: Stage 3, recovery. Thank you for listening Dr. Izzy's medical podcast series. If you want to support this project, please subscribe the channel and like this video. Thank you.